Welcome to continuing coverage of the World Healthcare Congress 2012. I'm here now with Schell, who's with Alere, and we're going to talk about really two groups of people: seriously ill employees and also high-risk expectant women, who tend to make up the groups that really need intensive care. How do you provide this while managing costs, Scott?
Well, you know, it's very interesting. If you look at employee populations, that 1% of the most complex care, whether it's chronic illness, cancer, or as you mentioned, high-risk pregnancy, can account for almost 30% of total healthcare spends. What's even more compelling is that when you look at that, those employees usually end up causing twice as much cost to the company based upon lost days. So we've really focused on developing a highly customized and very individual for each patient program that is quite holistic and brings to bear not only the management of the diagnosis that they've come to our care for, but really recognizes any other diagnoses that they may have, their family situation, any of their social needs as well.
So would the company need to come to Alere and say, this is what we need you to help fill the void with, this package of care and plans for these types of people?
Sure, you know, and every company is its own unique entity, and so most times companies will do a critical analysis of their patient population and their spend targets. Some companies have younger populations where the maternity issues may be a bigger factor of cost. Other companies may have more mature populations, and their chronic diseases and cancer may be of a greater issue. And that, I think, coupled with the health risk assessment, really is the best foundation upon which companies can make the decision for what sort of needs and gap filling they should pursue.
Okay, so we know these people, it makes sense that they might need more care, but really, what about the costs? How do you go about managing that?
Well, you know, it's very interesting. If you focus primarily on keeping the patient on track for their treatment or managing the risk of a high-risk pregnancy, the costs follow. And so really, it's all about educating the patient about their disease, engaging them so they can be proactive and advocate for their care, helping to manage communication between their provider or providers, and then continuing that cycle until they reach their goals. And when we do that, we find very consistently across our partnerships with employers, insurance plans, and now increasingly hospitals and accountable care organizations, that the costs follow.
Are you finding that employers are more receptive to bringing a company like Alere in to help manage this?
Certainly. You know, we've partnered with some of the largest employers in the country, and as a result we've gotten a lot of not only regional experience but also industry-specific experience working with companies that have either self-insured plans or deal with health plans directly to cover their costs. And those successes have really helped us understand the market and make us very effective partners to help these businesses evaluate where their gaps are and then fill them. So the need and the call for it are clearly on the rise.
And what else at Alere are you really seeing unique situations and where having a company like yours be involved makes a lot of sense?
Well, you know, it's interesting because many companies really sort of lack a culture of health. And sometimes a single event can drive a dramatic change in that culture. I remember the case of a gentleman who was a mid-level manager in one of our larger company clients. He had a colon cancer, and he also had some pretty debilitating heart disease. And the reality was that his heart disease, left unmanaged, was really going to slow down his progress through treatment of this relatively advanced colon cancer. And because we have a holistic, integrated team where we have specialist physicians and specialist nurses, we're able to bring him through his colon cancer treatment successfully. Well, interestingly, he ended up being the loudest and most vocal champion for the whole company, going up to upper management and really underscoring for them his perception of the value of what the company provided him, and then among his teams and reports to the lower level patients was really an advocate to help them understand how important this was.
Very good. All right, Scott, well, thank you for sharing your experiences with us.
It's a great pleasure. It's nice to see you.
Nice to see you. I'm Mabel Jong. Thanks for watching.